A very good evening all. I'm Aditi Lama with the Tues edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world is at 191 million cases of COVID-19 with more than 4 million deaths. The World Health Organization has said that cases and deaths are climbing globally after a period of decline, connecting it to the spread of the contagious and dangerous Delta variant of the coronavirus. On India, a comprehensive examination from the Center for Global Development has stated that India's excess deaths during the pandemic could have been as high as 4.9 million and provided evidence that millions may have died from the coronavirus than the official figures. That is 10 times the number of deaths currently reported and could surpass the global total deaths from COVID-19 if proven. Just over 8% of eligible adult Indians have received both vaccines. Here in the United States, we're at more than 34 million cases of COVID-19 and with more than 609,000 deaths. Delta variant makes up of 83% of cases here, and a troubling rise in cases has been visible across the country, especially in parts of the nation with low vaccination rates. Remember, you can visit vaccines.gov to get more information and locations to get vaccinated. With this, let's take a look at headlines coming in and covering much on COVID-19 and political updates. Here are the headlines. Counties consider mask mandates amid rise in COVID-19 cases. Dr. Purvi, Parikh, New York. Coronavirus becomes political issue in low vaccinated states. Veteran journalist Rohit, Vyas, New Jersey. Indian Business Association announces 2021 India Day Parade on August 8th, kickoff, New Jersey. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lama and this is Vision of Asia, Tuesday night episode of South Asian News. On COVID-19 updates and measures, cases are spiking in almost all U.S. states, with several southern states being affected the most by this surge. These cases of COVID-19 have been linked to the highly contagious and dangerous Delta variant of the virus spreading rapidly through unvaccinated communities and also communities that have been disproportionately affected. Healthcare workers in many of the southern states have been facing many hospitals out of beds, ventilators, and other supplies. These workers are also fighting misinformation that has been spread across the states and have been trying to get more vaccinated out of danger. Meanwhile, Canada is set to open up its country to fully vaccinated Americans starting August 9th. People eligible to enter Canada must be fully vaccinated at least 14 days prior to arriving in the country, and children under 12 who are not yet vaccinated will not be required to quarantine if traveling with fully inoculated parents. So how will this affect the pandemic in both nations, with cases rising across the United States? We spoke with ITV Gold's health expert Dr. Purvi Parikh on this and her take on unvaccinated individuals. Here is Dr. Parikh. Vax it and mask it, as some experts are saying that all across the country, cases of COVID-19 are rising, even in states like New York. So my first question to you has to be, are we in trouble?
Yeah, so we're not in trouble yet, but I would say those people who are choosing not to get the vaccine are in trouble, because over 99% of the deaths are now all unvaccinated folks. Over 90% of all the hospitalizations, ICU admissions are all unvaccinated people. So if you don't have your vaccine yet, please go get it, because these new variants are much more contagious and they are troublesome for those who are not protected.
Right. And the Delta variant is right now making up 83% of the US COVID 19 cases. Many are saying this Delta variant is like COVID on steroids. I'd like to get your insight into how you're looking at this variant and how much damage can this cause to even vaccinated people.
Yeah, it's troublesome because it's much more contagious. So you're much more likely to catch it than the original strains of COVID-19 that were circulating at the start of the pandemic. And the other problem is once you get infected, there's much more virus in your airways, they found. So the viral load is much higher. And that is what determines how sick you'll become. So it has a potential to be more dangerous, and even in those who are vaccinated, the vaccines right now are protecting against hospitalization and death, but they aren't as effective at completely neutralizing the virus. So we can still get milder cases of it, even if you are vaccinated. So that's why we're seeing a lot of shift back towards masking, especially when you're indoors and in public spaces for that reason.
Right. While we're talking about this, Florida Governor Ron DeSantis actually blames a seasonal pattern for the excess amount of cases that we're seeing in Florida. But isn't this due to the low vaccination rates there?
Yeah, absolutely. One seasonality, usually it's actually winter and fall where the cases go up because people are spending more time indoors and that's how it spreads. One can argue in the summer, maybe people are inside more with air conditioning in Florida, but Florida also has very low vaccination rates. And you can't ignore the fact that the places that have much better vaccination rates, the cases have dropped completely. And President Biden even said that this is now a pandemic of the unvaccinated. That's how different it is. If you're a vaccinated versus unvaccinated person, your risk is much, much higher.
Right. So could you sort of locate these areas for us? Where is it more risky? Where is it still okay?
Right. So it depends state by state. I know, unfortunately, Arkansas has a low vaccination rate. So their healthcare system is already getting overwhelmed and the cases are surging. We're seeing it in Alabama as well. And then Kentucky, actually, the governor yesterday said that he is moving back towards a mask mandate for the same reason. All low vaccination states who are seeing surges of this virus and increase in hospitalizations, which is what's most worrisome.
Right. These masks, do you think will again become a political issue? How do you look at it as a medical professional?
Yeah, I don't know why it ever was a political issue. It really should not be. We know that they work, that they protect people. I hope it does not become a political issue, but unfortunately it might be. Unfortunately, the vaccines are a political issue. All of these things are just basic medical facts that we know work, that save lives and protect people. So it really shouldn't matter what your political affiliation is if it's something that's going to help you and other people.
Some states or some cities, I must say, are now bringing back travel restrictions from states such as Missouri, where the cases are really high, the deaths are really high as well. So, they're making them do quarantining if they come from that state. My question to you is, should other cities follow this? And again, my follow-up question to you would that be, how can these low vaccinated states eventually affect states that are at 70%?
Right. So, I mean, those restrictions may need to be imposed because we know a lot of the spread is from travel. And so those states with the low vaccination rates, it can actually hurt other states, even those with good vaccination rates, because if it starts to spread, it can still affect those. And remember, these vaccines aren't meant to be 100% cure. You could still catch milder forms of the infection and spread it as well. And, in someone, it might not be so bad, but they could potentially spread it to a high risk individual where it could be deadly. So it is a concern because an outbreak anywhere is an outbreak everywhere. What's happening in Missouri could affect us, in a few weeks very easily.
Let's now take a look at IBA, the Indian Business Association, serving thousands of Indo-Americans for over 2 decades. The association proudly represents small businesses owned by South Asians on the popular Oak Tree Road in New Jersey, also known as Little India, and has a history of bringing forth more visibility and respect for the community in the state. On this, the Indian Business Association has been known to bring the largest India Day parade on the occasion of Indian Independence Day annually in New Jersey. Last year, this parade was cancelled due to the COVID-19 pandemic, but this year, adhering to all COVID-19 CDC guidelines, the Indian Business Association is bringing back its annual India Day Parade next month on August 8th at the Oak Tree Road, dedicating the parade to all healthcare and frontline workers who have been the strongest pillars of protection and help during this pandemic. There aren't enough words to thank them. This IBA India Day Parade will feature many displays of India's culture and heritage, along with several politicians, community leaders, and Bollywood celebrities. The Indian Business Association recently held a kickoff event to announce its upcoming India Day Parade on August 8th and to invite the greater diaspora to participate in the celebrations. Here are some highlights from the kickoff event.
भारत माता की जय, भारत माता की जय, भारत माता की जय, वंदे मातरम, वंदे मातरम, वंदे मातरम, IBA जिंदाबाद, IBA जिंदाबाद, IBA जिंदाबाद.
I would like to thank all the medias to covering the kickoff event of India Day Parade 2021, which is happening on Oak Tree Road from Edison to Islin. Please join the parade on August 8 from Edison to Islin, sharp 1 o'clock from Cinder Road and Oak Tree Road intersection.
ये परेड जो है वो इस साल की इतनी बड़ी है, हमारे प्रेसिडेंट ने इतनी मेहनत की है, ऑल फायर वर्क्स, एम्बुलेंस और ये सब. और लास्ट ईयर भी ये करने वाले थे, हमने 50,000 मास्क बनवाए थे, ये थे, मगर गवर्नर ने लास्ट मिनट रिक्वेस्ट की कि भाई आप ये नहीं करो तो अच्छा है, तो हमने वो ये नहीं किया. पर इस साल ये परेड उससे इतने ही ज़ोर से होगी, इतने ही लोग जॉइंट होंगे और बहुत अच्छा रिस्पांस मिल रहा है. स्पॉन्सर भी बहुत बढ़ चल के ये कर रहे हैं.
My name is Mahesh Shah. I'm a Vice Chairman of Indian Business Association. As we declared before, this parade is dedicated to all frontliners, all the healthcare workers, all healthcare heroes, and you will see in the parade we have invited police department, fire department, hospitals, everybody to come and join with us on this parade day. We also like to get the support, and we have a support of more than 100 New Jersey-based Indian associations. So we want all of these people to work with us and come and join the parade. Thank you.
After parade, we have a gala dinner on Monday. So we going to only invited people going to be attending there. And we have a lot of culture program also there, and so enjoy it. Thank you.
All the viewers of New Jersey and entire US, this is a unique parade IBA is doing since last 17 years. So please join and watch. There will be a live from TV Asia and others. They're going to have a live parade on August 8. So please stay tuned on August 8 from 1 o'clock onwards. Thank you.
This year, our 17th IBA India Day Parade on Oak Tree Road, and we are doing as a first responder who help the community, and that first responder, doctor, nurses, pharmacists, lot of people. So all these people, we respect them and we are honoring them. So this year, all local townships nearby in Middlesex County, everybody, fire department, EMS, all these people coming, and we invite them and we are honoring them. So this is a unique parade this year we are doing, and I request all the people, please come and join.
We have a cricket party today. India IBA parade organized. This is 17th parade of the year. IBA is doing in this area for 30 years, and this is the 17th parade. We have a kickoff party today, and all seniors are supporting IBA for the party. And we request all community people to come in the parade on August 8th. And let's have a successful parade on August 8th. Thank you.
Hello, this is Raman Patel from Woodbridge Senior Association. We always support IBA. This year also we are going to support IBA and we will help whatever way we can. So, good luck IBA.
Hello, thank you ITV. We are celebrating here kickoff party for the IBA from Edison to Islin, and this is the wonderful party. So we need everybody's support. Come to the party and enjoy. Thanks. Have a great day. Bye bye.
Okay. Good evening, ITV viewer. I'm Viru Patel, councilman from the Woodbridge Township. Today is actually kickoff of IBA, and it was held at the TV Asia studio. We had about 300 strong community leaders and very prominent, I would say, businessmen. They are here to just celebrate the IBS kickoff for the parade. Parade is going to be on August 8th. This whole parade is going to be dedicated for the frontline workers. That was the main theme.
Today we have kick-off party for the India Day parade on August 8th. Now, this parade will be very unique parade. Lot of front fire department, doctors, nurses, all are participating, and the parade make a very successful, and wish everybody to join and enjoy it. Thank you very much.
It's time for another short break on Vision of Asia, Voice of the Community. Don't go anywhere. We'll be right back. Welcome back. I'm Aditi Lama and this is Vision of Asia South Asian news segment. In politics and more, the spike in overall COVID-19 cases and deaths has now created a political chaos, with many left wondering why US states with low vaccination rates are not implementing measures to mitigate the spread of the virus and are not encouraging inoculations. A lot of these states that have been facing a rapid spread of the coronavirus are mainly GOP-led and southern states. Several other states who have high vaccination rates but are currently struggling with this new surge have now started to reinstate mask mandates indoors, or are at least recommending it even for vaccinated individuals. States Arkansas, Missouri, and New York are weighing these mask mandates as they see a rise in cases and deaths from COVID-19. Many experts are encouraging state and local officials to assess the COVID-19 situation in these cities and states to figure out if they need to impose new restrictions to curb the new wave of this pandemic. But why is COVID-19 and protection from it such a big political issue? Why can't southern states enforce measures to prevent it even worse from happening? ITV Go's senior political commentator Mr. Rohit Vyas has some answers. Here is Mr. Vyas. One of the biggest news today is the spike in COVID-19 cases across the nation. This Delta variant is making up of 83% of these COVID-19 cases. A lot of the states in the South, Midwest, and the Southwest are seeing a lot of low vaccination rates and really high case numbers and deaths. My question to you is, on this, the Florida governor, Ron DeSantis, says that he blamed the seasonal pattern, not low vaccination rates on it. Is it okay for this to be a political issue right now? Shouldn't the governors and other state officials be promoting these vaccinations?
They should be. They should be stepping up to the plate and making sure that everybody gets a vaccine. It's a no-brainer now. By this time, you know, the stats are out there. It's playing out before our eyes and ears that people who are unvaccinated, namely the young, are getting infected, going to hospitals in larger numbers, and unfortunately dying of the new variant in larger numbers as well. The southern states you mentioned, Arkansas, Louisiana, Tennessee, many of those states now, the hospitals over there, according to the latest reports, are gearing up for a fourth wave. They're calling it the fourth wave of the COVID pandemic. And that is ominous. That means doctors are going to be hard-pressed once again. First responders are going to be hard-pressed once again. The frontline workers, nurses, hospital workers of all, hue, and they're going to be in trouble now, having to deal with this sudden surge in patients. And all it takes is if everybody gets vaccinated, we'll be clear of this for the most part. What's happening is the vaccine hesitancy the resistance to it, and much of it is because there's all these rumors that are circulating in social media. All of it has been debunked. All of it is false. And yet people seem to be this hesitant. I believe we have less than half the population fully vaccinated right now in the United States. That means more than half are not vaccinated. And what we're doing is giving a loophole to the Delta variant and the Delta Plus variant, which is now being seen in some states and probably will be seen all across the country very soon. We're giving a loophole to these to come in and make basically what we've had so far, the protection of the vaccine, either useless or we'd have to get a booster or something like that. But nothing's going to happen if the rest of the people or population, or at least a good portion of the remaining population, does not get vaccinated. Yes, playing politics at this time, a very grave error for the happiness, the health, the well-being of humanity themselves.
Do you think with the elections that are coming and the elections we're going to see in November and then again next year, is that the reason we're not seeing mask mandates in these states?
No, I don't think it's that, but I think it's just this disbelief that no, it can't happen. And this is a natural course. I mean, you mentioned Governor DeSantis making a statement. If he did make that statement, I didn't hear it, but you've quoted it, so I'm sure it's accurate. If he made a statement that this is seasonal, then there's a big problem. This is not the flu. This is a deadly virus. That's why we called it a pandemic, because it's taken so many lives and has threatened the survival of humankind. And so this is not to be treated lightly whatsoever. And whether it's election time or not, we better follow the science in this case. I think the Surgeon General, Dr. Vivek Murthy, has made an impassioned plea as well on national television, asking every American to please don't think of yourselves now. If you're unvaccinated, think of everybody else. Think of those doctors who will be overwhelmed. Think of them, their families. So stop thinking about yourself now and be community oriented in this, that it's all of us against a terrible virus.
And on this misinformation, the Surgeon General, as you mentioned, actually called out tech companies and social media platforms for letting the spread of the misinformation happen. My question to you is, what is the legal liability of these social media platforms when you're looking at misinformation? Could they really be called out on it?
It's a gray area. I mean, there is no legal implication that has been drafted for something for social media platforms, etc. It's going to have to be legislated, but I think that will not happen. The whole idea of social media platforms is the freedom to speak and freedom to voice your opinions, etc. I think what Mark Zuckerberg and some of the others and all these, on Twitter, on Facebook, on the Google Talk platforms, whatever they are, they've been trying to put in some mechanisms or tools to sort of isolate those who might be creating deliberate misinformation and therefore disrupt society. I think that's what they're all working hard on. You have to give them a chance, but I don't think I'd hold them responsible. They're not really responsible for directly inflaming anything. They've given a platform, and it's up to people to use those platforms responsibly or not. Generally, when you deal with something like this, social media, society, that's where you get the term social media. Society cannot be left to its own entirely. That's why you have governments. That's why you have somebody who's a leader, is because if you leave society to do what they want in the larger context, you can have chaos. And that's what we're seeing on social media platforms. This misinformation campaign is nothing but sowing chaos. There are vested interests, whether they are state authorized or just individuals who want to create mischief, who will put out misinformation. And for the most part, unless it is vetted, that's where journalism comes into true practice, is journalists are the ones, that's their job, to vet everything that goes out there. And that's why when I, for instance, tweet something or I put it on Facebook or whatever, I make sure what I'm putting out there is absolutely accurate. I guess I'm from the old school of journalists. We have been trained and taught to vet everything so that if an Aditi Lambat comes to me and says, hey, this is what I know, this is what's going to happen. It's my job as a veteran journalist to sit there and vet what you're telling me and to check out the veracity, make sure it's absolutely true. But to the legalities, it's a big question. Like I said, it's a gray area. It's something that's going to have to be discussed in larger fora, including Congress, for instance, here in the United States, and various parliamentary fora around the world.
With this, we wrap up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I'm Aditi Lamba. Take care and be well.